Our local hospitals are headed toward a crisis point as cases continue to surge with this latest Delta variant of COVID-19. In today's KSAT Q&A, we are joined, as always on Thursdays, by Dr. Ruth Berggren, infectious disease specialist with the Long School of Medicine at UT Health San Antonio. Doctor, thanks for being here, as always. Let's start with what our hospitals are facing, because this has implications for people not only suffering with COVID, but any other reasons to head to a hospital. So what is the situation in our emergency rooms right now?
I'm sorry to bring a tough message to San Antonio this evening, but I was just on the phone with the director of our emergency medicine department, Dr. Riviello, and he told me the truth, which is that there are just record-breaking numbers of people in the emergency room and also in the hospital. We have a lot of people in the emergency room, both with COVID and without COVID. It seems to be just a really high volume time for people getting sick in general. And our message is, don't come in unless it's a true emergency, and also to use some of the urgent care centers that we have all over the city to take care of your other needs. But, we're seeing a doubling of hospitalizations due to COVID about every 10 days to 2 weeks since the middle of July. And we're at a pretty high level right now. I think we have a graphic that can demonstrate this right now. I want people to see just how steep that curve is and imagine what will happen if we do get another doubling in just 10 days. We see here that the risk level that is on the City of San Antonio's website is now severe. It's no longer moderate, and it is reflecting not just the increased percentage of positivity in the community, but also the level of stress for the hospitals. So here's the inpatient trends for all of the San Antonio healthcare systems together. And actually that number of 938 was updated today to 967. So just between yesterday and today, it continues to rise. And just look how steep the slope of that curve is. It's rising even, I would say, more steeply than it was last November. So we're unfortunately heading into a situation where the hospital systems are already strained. And if we continue to have these cases come in, they're going to be strained to the point where we're not going to take good care of people with strokes, heart attacks, and car accidents. And I wish I didn't have to say those things, but I need people to understand this is where we are. Your healthcare system is extremely strained right now.
And keeping people out of the hospital, not necessarily keeping them from getting infected, but keeping people out of the hospital, the vaccine is what's key for that. Is it correct that we're still looking at a overwhelming majority of people who are unvaccinated ending up in the hospital?
That's so true. And another way of looking at it is if you look at all of our new cases in the last 4 weeks, only 5% of these new cases, 5%, are in vaccinated people. The rest are in the unvaccinated. And if you look inside the hospital, it's still true today that 90% of the people in the hospital who are in because of COVID are people who are unvaccinated. Now, a small percentage of people who are vaccinated have shown up in our hospital, and some of them are pretty sick. To date, in San Antonio, we have 0 deaths in the vaccinated population. So we are seeing 100% protection against dying if you were vaccinated. That sounds pretty good to me, and it gives me some comfort, and I'm glad I was able to get the vaccine. And I desperately want to message anybody in San Antonio who hasn't been vaccinated to please go get one. You can go to Walgreens, you can go to CVS, you can go to HEB. You can go to the Alamo Dome Wednesday through Friday in the afternoon from 4 to 8 p.m. You can come to see us at UT Health. We're vaccinating as well in our outpatient clinical building every single day, morning and night. So it's not hard to find vaccine anywhere in this city, including our mobile vaccine administration units that are going all over the city to have pop-up clinics. And we're talking about adding odd hours. You've heard that there's been vaccination at the airport. Mm-hmm. So we're trying to be really creative and get this out to people as best we can.
Plenty of opportunities.
I know the advice for now the vaccinated and unvaccinated is to mask right now with such the spread that we have in our community, doctor. So just explain again, even with the Delta variant, how masking is still effective.
Right. So you've heard that the Delta variant has made the virus more contagious, but it didn't make the virus get teenier and tinier. It still will be blocked by a physical barrier. So it still makes all the sense in the world to put your mask on. And in fact, that is everyone's recommendation up and down the line, is to wear a mask when you're in any kind of a public place, whether you're vaccinated or if you're unvaccinated. And by the way, no one can tell me I can't wear my mask. Think that to yourself. And think about that when you go to the supermarket. I was in the supermarket on Sunday afternoon doing my weekly shopping just this past week, and about a third of the people in there did not have a mask on. That's just a couple of days ago. That shouldn't happen. Put your masks on when you go to the supermarket, wash your hands, and watch your distance and stay away from people.
There are so many questions that I wish we had time to get to, but I know a huge concern for people right now, based on the volume of emails, comments, questions we are getting, is kids. Kids going back to school with what we're seeing, more severe cases, more serious cases in children with this Delta variant. What is your advice to parents who are sending kids back into the classroom?
Right. So your concerns are well-founded, and it's not a lie that our hospitals are seeing more and more pediatric patients, even very young ones, getting very sick. And one of the ways that all of us in San Antonio as a community, one of the ways we can protect our children is for us to get vaccinated, because that does add a measure of protection for the kids. So that's number one. The kids who can't get vaccinated yet are going to benefit when their moms and dads and their home caregivers and their teachers are vaccinated. Next, I strongly recommend that children mask in school. They should mask, and they should all be educated at home about smart things that they can do to help minimize their risk, like remembering to wash their hands often, and like keeping their physical distance away from other people when they're engaging in activities. And one of the most important things is about eating. A lot of the outbreaks that we're seeing, even in the vaccinated people here at our own Health Science Center, have happened when people take their masks off and sit down and eat together. You know, they may have gotten a boxed lunch from somewhere because they were being careful and not eating from a communal tray, but then they take off their masks and they eat. Now, that will happen in schools as well. And so I think that kids who are in school need to be taught that that time when you're eating is a time of potential for transmission, and it's where, if you can be outdoors, that would be safest. And certainly you want to keep physical distance from other people when you have your mask off.
This will be a challenge for teachers, parents, administrators in the next coming weeks, and certainly one already for our healthcare providers. We always appreciate your time, Dr. Berggren. We will see you next week to tackle more of these big questions. Thanks so much.
It's always the right time to do the right thing. That's a paraphrase of Martin Luther King, and we should all remember that.
Thanks for sharing that as well with us tonight.
Thank you, Doctor. And we'll be right back.